I want you to tell me what are some key takeaways for patients during this time. It can be very emotionally and physically difficult for our bodies. We're not used to being isolated. What are some good and helpful things patients can do?
Well, that's very true, and I want to leave our audience with some things to think about. Many of us are in isolation, including myself at this point, and there's certain steps you can take to stay healthy and engaged, even while you're in isolation and during this difficult time. And here are some of the pointers to take away. First of all, get up at the same time that you would every other day. Set your alarm clock. Don't use this as a vacation and your internal clocks will start resetting. And you want to get up in the morning. Don't stay in your bed clothes. Get dressed. If your job generally starts at 8 or you generally start at 9 o'clock, get ready, get dressed, feel yourself. Women put on makeup, men shave. Make sure that you're following a routine. The next thing to remember is that our muscle tone is maintained on a daily basis. We may not realize it, but those of you who have a step counter will know. In our daily lives, we may put in 5,000 steps. When you're at home, you should maintain some sort of exercise, either organized, or if you have steps, if you can't do steps, walk around your apartment. Keep your muscle tone. It's okay to go out. There's nothing wrong with going in the outside. Now, I take walks. I make sure that I'm going at times and places where there's not a lot of people, but I walk on the sidewalk or by the curb. If somebody's coming, I sort of keep my social distance, and I get my exercise every day. I can tell you that that it's just like we hear about the astronauts who go to space and they lose their muscle tone within a couple weeks. That will happen to us too. So that would be my next pointer. The next thing I would say is naturally eat healthy. I've heard of people complaining that they're gaining weight when they're at home in isolation. Don't let that happen to you. One of the things that I'm doing is trying to eat fruits and vegetables for lunch. I keep a light lunch, fruit and vegetables. Then at dinner, I'm nice and hungry. I get a good meal, and I'm maintaining and drinking lots of fluids, maintaining nutrition, maintaining hydration. So those are the things for self-isolation. And I just want to say a few words to maybe bring some light at the end of the tunnel. And it's very early to say, and who knows when the exact date. But as I said earlier, there are thousands of patients who have had COVID. I wish the news media would talk more about this, who have had COVID and they're now back at work, totally done. I can tell you, they're all very happy. They don't have to worry about themselves getting infected again. We don't know the exact immunity that you have from the virus. Is it going to be like seasonal flu where we will get it this year once, we could get it next year, or would it be more like measles where we get it once and then we're covered the rest of our lives? We don't know that yet, but we do know that once somebody has it, they should be okay for at least some time. And finally, there's lots of resources. Keep yourself, remember the basics of social distancing, washing your hands. And one of the things that I always tell people about washing your hands is most people wash their hands, they wash the palm of their hands, they lather up, and don't forget the tips of your fingers. The tips of your fingers is what's touching people. Wash your hands, scrub your fingertips into your palm after you've lathered up. Make sure your fingertips are clean under your nails. That's where germs seem to like to stay. Those are important things.
Mm-hmm.
Don't touch your face more than you have to. Remember, these germs enter through our nose and mouth. Even though they talk about the virus can be alive on a surface, it's not going to jump off the surface in most cases into you. It's going to get from the surface by you touching it and then touching your face.
Mm-hmm.
So avoid touching your face. And I think if you do all those things, people working very hard on treatments, vaccines. I think by next year we'll have a vaccine. So let's all try to get through this as best we can, support each other, and we will, and I'm hoping for the best for everyone. So good luck to everyone. And if you have any questions, certainly you can submit them to Olivia, and I will try to answer them if I can.
Okay.
Thank you all. Goodbye.
Thank you, Dr. Lebow. It was so great talking to you.
Thank you.